Hey, welcome folks to the latest and the greatest show on earth today. As I put in the chimes that I think you may have gotten a copy of, that CINC has not sunk. We thought for a while it might be on its way out, but due to the geniusness of two of our people, Tom Mackner and Pam Benfer, we have a connection here with those two rooms down there. I always get them mixed up. They're the River Lounge and the Gathering Place, whatever they are. And we welcome those of you who are down there. I understand this whole system, we can communicate back and forth. We just need to be not too fussy if it doesn't go exactly the right way, okay? We've never done this before. Now, let me mention a few things and then we'll get on to introducing our new members. It's interesting that if you notice, there are 5 rows with 5 chairs in here. And sitting exactly in the middle of this place is the man who started this almost 10 years ago, Bill Hiller, the guy in the green shirt there, and some other residents.
Pam, we can't hear anything.
What?
They had it right, now they've got it wrong.
I wasn't planning on interference from there. That's an outer voice somewhere. No, thanks to Bill and his efforts, the CINC organization came into being. It'll be 10 years in this coming March. And he has put an awful lot of time and energy into what we have. And I just personally wanted to say thank you, Bill, for the hard work that you and your team have put together. And we're going to do our best to keep it going. It might look a little different, but thank you for all of your efforts and your time. Also, as I said, Tom Mackner and Pam Benfer are the two, what do they call them, techies that have put this together. And my understanding is that we have a group in the River Lounge and a group in the Gathering Place. Thank you. And I understand that you can see this on 266 in your home, I believe. Is that right, Tom? Okay. And this probably is going to be our format for several months to come. And so we'll work out some kinks today and make it better for the next time. Also want to thank the members of the CINC committee that some of you have run into. Rachel Cohen is out taking your temperature, and Charlotte Flores is out handling the name tags. And down in the River Lounge is Charlie Eichner, one of our members, who will be sort of the moderator of that group. And then way on down is Bill Walker, a relatively new member, not only of our committee, but also of Westminster Woods. And I want to appreciate the work that they've done. The format of this meeting is very simple. I get to introduce the new members. And I've stayed up all night reading my joke books, and I'm not going to make a joke out of anybody but me. Okay? So, let's, what I have here, we have somebody named John and Peggy Hunter. And I'm going to get you all to come up here, and that way you get to be on television. If I come to you, then you won't be seen. These are the Hunters. They've moved in here several months ago and live over in Southwood. Now, I know how much he can talk, but we'll give you the microphone. Tell us where you came from to get here. I got it.
Okay. Well, we came from a very far away St. Augustine Beach.
Good, good. And how long were you there?
29, yeah, 29 years.
Okay, has the Fountain of Youth moved at all in those 29 years?
No, but before that it did. So we heard that the fountain had to be moved for the tourists. So the water was moved with it, I guess.
Well, that's good. As a person growing up in this area, I know of 2 different locations for the Fountain of Youth in St. Augustine. John, what do you want to add, or what do you do, or what did you do to put food on the table?
Well, I've been a teacher and a preacher, and I'm retired. And I'm a buyer and seller of stamps. I'm a big philatelist at this point.
A big what?
Philatelist. I can sell you stamps cheaper than the post office. The postage.
Line up at his door, right? Tell us right quick about your family.
We have 2 children, a daughter and son-in-law that live in Newport, Rhode Island. They both work at the Naval Air Base, Naval Air Station there, and they have 2 granddaughters. One's turning 18 next week and going to state college in Pennsylvania, and the other is going to be I think a freshman in high school, sophomore in high school. And our son is a Presbyterian pastor in Denton, Texas, and he has a 5-year-old girl too. So.
All right, which of the 2 is the better preacher, your son or your husband?
Well, I haven't heard.
Thanks for the hunters. We're glad to have you. I'm not going to make you answer that question. Thank you for being here. Welcome. Oh, Cheryl Dorr. Hey, come on up. Come on down. Well, like I say, if I go there, then you won't be able to be seen on television.
I actually moved here in February, and it's been a delight. I have friends here, and even before that, often they had a fall or spring festival here on the grounds where everyone was invited. So about even 20 years ago, I had become introduced and fell in love with this place. So in February, I decided I was living in Solano Grove and renting, and I decided I would become part of this community. And it's been very special, and it brings new things into my life every day. And I hope that all of you have the same experience and love of this place as I do.
Good. Tell us a little bit about your family.
Well, I'm a widow, but I have 2 stepsons that have been just wonderful and part of my life for 30 years. And it's just been great. I had a career here for 35 years in elementary education as a teacher. So it's just, I've come out here to the festivals, and as I said, I just knew in my heart this was the place to be as my last dwelling place, and it's been perfect. And I hope to get to know some of you very well.
When we can get close enough to shake hands and hug, you'll get to know some folks, I'm sure. But welcome.
Thank you. It's been delightful, and I hope all of you have the same experience here as I have. Thank you very much.
Good. Good to have you, Cheryl. Have you ever tried to lick your finger and turn a page?
Yes.
How about Pam and Drew Thomas? Oh, I need a step stool.
Oh,
Let's see.
right.
Big boy,
Hey there.
tell us where you're from.
We moved here from Raleigh, North Carolina. Had been there 24 years. We've actually known Dwight and Sarah for a long time.
It's 1996.
94.
94.
We met in
Wait a minute, I don't do marriage counseling up here.
we met in an airport in Scotland.
Yes, we did. And I have to tell you this about this guy right here. He had a father who was 6'7". And Sarah and I happened to sit behind them on the airplane all the way across, and you could just see the tops of seats, and then here was a head, and here was a head. Tell us more.
Drew's mom is Doris Thomas, and she lives in Magnolia. We have visited with her for almost 8 years now, 3 and 4 times a year, and sometimes maybe more. And we absolutely fell in love with Westminster Woods. I think it's a gorgeous place. We loved the staff, the programs that were offered, the way that people interacted, and what we found was that everybody wanted to be here, and everybody wanted you to be here. It was very, excuse me, very welcoming, a very loving, nurturing environment. So we decided that when we wanted to downsize, that we would go ahead and downsize and come here. So we signed up just as I was turning old enough to come in.
Good.
And I'm just so excited to be here. Drew and I moved in the end of March, and we've loved every minute of it.
And you live in Eastwood, right?
Eastwood.
Good.
Yes.
Well,
Mhm.
Welcome. Glad to have you with us, folks. For sure.
Thomas.
Sam and Drew.
Thank you, and they live in Eastwood.
Jefferson, Ernest, and Sue. Hey, come on down. You could ride with this guy on the airplane, and I could sit behind you and still couldn't see. Ernest and Sue Jefferson. Oh, tell us where you're from.
Well, a lot of places, but we moved here from Citrus Hills.
From where?
Citrus Hills, it's between Crystal River and Inverness.
Down there where they grow oranges. Yeah.
They do.
Good. Tell us about your family.
Well, I have a daughter in Durham that's doing PA work, and this is our second marriage, so she has a couple of children not too far away in North Carolina and one in New York. And we moved here from eastern North Carolina, and we went into villages for a few years, and they ran us off. It got so crowded. So we moved to the last place was kind of in the country, and now we're in the city.
You're in a big city
I
now.
found it yesterday at exit 12 off of 295 at 7 o'clock when it was raining. That was quite an experience.
Next time, if you're driving and it's raining like that, just stop. But we're glad you found your way. Yeah. Tell us about this extended family.
Oh, wow. That's a story in all in itself.
Well, lunch is not served until...
You have?
Yeah. Children? Or...
Yes. We have, how many children do we have now? We got about 5.
5 children?
I unmuted at your request, Pam.
Thank you, Pam. And you all live where?
We live in Eastwood, too.
Eastwood.
Yeah.
Okay. Good. Welcome. We're glad to have you. Look forward to getting to know you better. Good. Larro, Larro. Okay. How about Duck, Audrey Duck? Oh, can you come up here? Good. I guess I could walk back there. We might be in camera range, but this way. Audrey, tell us where you're from.
I moved from Middleburg, Florida.
Look that way. That way you're on the camera.
Okay.
Middleburg, Florida.
So on the other side of Orange Park.
Oh, okay.
It's not far.
It's that big city just south of Orange Park.
That's
Yeah. And how long have you been here?
I've been here since May. May.
Okay. And you
I
moved?
love it. I absolutely love it. I have 2 daughters that live here locally. One of them's a doctor of nursing, and she's had a patient here before. And she said, "Mom, you'll love it." So we saw it virtually, and I fell in love with it.
Good.
I've loved every minute of it.
Now, where were you born and where did you grow up?
I was born in Chattanooga, Tennessee. But I've been really in Florida since I was 10, so this is home.
Yeah, and you live in
C9.
C9. That's Camellia, if you don't know what C is. Good. Well, welcome, Audrey. We're glad to have you.
Thank you.
Look forward to getting to know you better. Watt? George Watt? No? How about the Klein? There we go. You just moved in and you just got some new grass in your backyard.
Yes, and plants in the front.
Yeah. Tell us where you're from.
Well, we moved north for colder weather. We were from Clearwater.
Okay.
And we moved up here because our daughter lives up in McClenny. And it just looked like the perfect place. And I loved the fact that it's a faith-based, nonprofit faith-based community.
Yeah, yeah.
We moved without seeing it, like I guess some other people did too. So it was wonderful. But we got some videos, and so far we're very
Pam,
happy.
you and Tom are not music.
Good. And I understand you have a husband who likes to play golf.
Tennis.
Tennis.
Yes.
Well, that's the same thing, isn't it?
Not if you talk to a tennis player. Yeah, no, he's playing tennis right now, as a matter of fact, which I'm thrilled about because I really wanted him to get involved in being able to play tennis because I think that.
Now, don't you think it would be really neat? Turn and look at that man right there and tell him how nice it would be to have tennis courts on our campus.
Oh, my God. Well, my husband would be in seventh heaven, but you've got Mills Field.
Millsfield. Okay, that's close.
That's
Yeah.
very close.
Good. You have any family?
Yeah, we have a daughter and son-in-law and a 20-year-old grandson that live in McClenny, and he goes to FSU.
Oh, good, good. Well, welcome, and tell your husband to keep his head down when he swings after those balls. Good to have you with us. Now, who have I missed? New members. Oh! Gosh. Holland. Well, come on up here. Come on. Because there was a very famous person from Florida by the name of Holland. Are you related to Senator Spencer Holland?
I'm not related to him now.
Oh, okay.
But he was the governor for a while.
Yeah, and he was also a senator, I think.
True. Yes.
Yeah. Okay. Well, tell us about yourself. Where'd you come from?
I'm born and raised right here, Jacksonville, Florida.
Well, now let's talk about Jacksonville. Where did you go to high school?
Wolfson High School.
That wasn't here when I went to high school. And are you from Jacksonville?
I was born and raised in Tampa, but I moved up here in high school. So I've been here since high school, except while I was in the Marines.
So it was Marine Corps a career?
Oh, no.
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 What did you do for a career?
I drove the amphibious tractors that one just sank last week in Pacific.
But when you were working in your non-military days, what did you do?
45 years in banking.
Banking? Do you need any money? He's our man. Welcome. And tell us about your family.
We have 2 children, a son, a daughter-in-law, and 3 baby girls. And we have a daughter here, and a son-in-law, and 2 grandsons.
Good.
And our children, we both graduated from Wolfson, and both of our children graduated from Wolfson.
Well, that's okay. There was another school on the Riverside called Robert E. Lee. Okay. We're still fighting about that statue somewhere. Hey, we're glad to have you and welcome. I'm sorry I didn't call you up front.
We're Bob
Good.
and Bobby.
Bob and Bobby. Good to have you.
Thank you.
Now, who else did I miss? Anybody? Okay, now the fun stuff comes. Okay, we have, normally, for those of you who are new, we always have 1 or 2 speakers from some area of administration on the campus. And today we have 2. Brian Tenney is going to speak first, and Brian is our executive director, and he's the one that brought COVID to us. How's that for a distinction? No. Brian came right at the beginning of COVID when things were shutting down. And matter of fact, when he came on the campus, he was isolated for 2 weeks. But we're glad that Brian is here. And then also we have an old timer in terms of length of service. And that's Marilyn Cameron. And now that you've heard both of them, do you all have questions for them? No. Come on, Brian, talk to us a little bit.
Well, good morning. It's great to be among such distinguished people and a community that is so engaging and excited about living here at Westminster Woods on Jollington Creek. And after spending a little bit of time in Hibiscus myself, and now it's been, 5 months since we've been working together, I can totally understand why all of you have chosen to move here and just be a part of this great community. There's a lot that is being offered here, and it's great that Mr. Hiller and Mr. Bailey are involved in enabling people that are joining our community to become familiar with one another and what goes on here, to become more acclimated. To give you a little bit of information about myself, after I had done my internship at Penn State University, I found that a career of service and making a difference in the lives of others is what I wanted to do. And I've been serving older adults for well over 20 years now, and I'm grateful to be a part of this community and look forward to many years that we are going to be working and experiencing new things together. I know that this meeting is, and this presentation is geared toward new people, and there's probably more new people since the last time that we've had a meeting like this. But under the circumstances, we can probably consider ourselves new, because all of this is new to us and what's going on. And I want to thank those of you that have moved in since the beginning of the year for how courageous and brave you have been to make a life change, and one that's going to help you out in the long run to come to this community. So it sounds as if CINC is the first thing that people might get to be a part of to get acclimated to our community, but there's many ways in which we communicate here. And one of the first things that we have and that we provide you for communication is the handbook. And the handbook gives a lot of different information, and as I've been reviewing the handbook, I see that some of the stuff that's in the handbook is not consistent with what our current practices are. A little bit of history that I learned in the process of this is that we used to have a postmaster on campus, and that the postmaster was the only person that could deliver mail, and that we had specific times for the different neighborhoods in which the mail would be delivered. But that's changed. And before COVID, we had a normal postmaster or a postman, postwoman, postperson delivering mail to us, and sometimes it comes at one time and sometimes it might come a little bit earlier or later. But now that COVID is here, the Postmaster Union has said we don't want our postal carriers to be going on to senior communities. So they don't come on. And therefore, in order for you all to get your mail on a daily basis, it's important for us to help step in and to make sure that you are getting your mail. But the handbook says that Westminster staff are not able to deliver mail. And things change. And I don't think that the handbook was ever written to be a static document that would never change over time, because we want to be able to make changes that are going to be for the best of our community and to mold to the culture of what our community is here on this beautiful campus. So there are two parts of that handbook. One is a part that I'm referring to right now that probably should not have as many changes over time. And then there's the appendix. And the appendix are the areas in which it's expected that there might be even annual changes to what's going on our campus. And we want to make sure that we keep that current and that it's a valued resource and a good form of communication to new people that are coming into our campus. So that's one way that we communicate. We also have, as you've probably seen, a lengthy newsletter called The Chimes, where we try to keep you up to date on different information that's going on campus. There's opportunities for registration. Our campus is being regarded as the more tech-savvy campus, and we do a lot more through the MyW Live and other electronic means of communication. And other campuses are looking to us to learn, and right now they're excited about what we're doing and how we're able to involve more people in this meeting and in this presentation than the limited 25 that we would normally have at this time under these circumstances. So there's a lot of information on MyW Life, and 266 gives current changes and schedules, so anything that might get canceled or any important information might come about there too. But you've also become very familiar with the letters that we are providing, or that I am providing, or Gary Hennis is providing, to try to keep you up to date on what's happening within the organization, within our campus, and even more specifically with COVID-19. So as I've been getting familiar with all these different forms of communication, I'm working with the leadership team to try to stratify what information is most appropriate for each of these different mediums of communication. For instance, there's call-em-alls. And maybe in the past we've used call-em-alls for informative stuff, but going forward we're going to try to just use the call-em-alls for urgent or safety-related issues. So that when you get that phone call, you can count on that call giving you information that's going to be specific to you. We have the opportunity to designate what parts of campuses are we designating the call-em-all for. It doesn't have to be an all or nothing situation. So if there's something that's happening in Southwood, we can just do a call-em-all for Southwood residents. So you can know that if that call-em-all is coming to you, it's specific to your area, and it's urgent and or safety related. So those are some different ways in which we're looking at how we can impact the communication here on our campus. And one of the other things that we've been really working hard on is resuming services in a safe and conscientious way so that there's more going on our campus. And we're very proud of all the activity that you all are able to have. Some of it comes naturally based on the size of our campus and the fact that we've got such great outdoor space. Some of the other campuses are just high-rises, and there's not as much opportunity for them to get out and to get around. But even with our campus being what it is, there's still things that people really long to do, and things that many of us who are new to this campus have not seen yet. So we're trying to make sure that we are resuming things in a systematic way. And most recently, we were the pilot for opening up the fitness gym, or the fitness center. And that pilot has gone very well, and now all the other campuses are opening up their fitness centers in a similar way. Previous to that, we had the fitness classes that were taking place. We opened up the beauty salon very early on. We're one of 3 communities that still has dining services open. And if you read the letter that I put out yesterday, we're going to be making a little bit of a pivot to try to best serve you all and also help out the kitchen and how they can best serve you. and minimize the congregation that's happening outside of the dining room based on the 2 seating time structure that we have now. So it'll be more like what you had before with more of a staggered seating for an hour-and-a-half period of time. But to try to keep things going, there is the opportunity to sign up for what time within that hour-and-a-half. There's 2 options to come and be seated. So we're hoping that that goes smoothly for you all. We're coming to the end of the summer. The students are going back to school. We depend heavily on high school and now some college students to be able to serve in the dining room, do the deliveries out on the campus. You may not realize, but prior to COVID, I think that if we did 12 deliveries a meal, it was a lot. And now we're doing over 40 deliveries on a regular basis, in addition to serving in the dining room, and just trying to make sure that we can provide a great service to everybody. So we do have the same meals that are being served in the dining room, being served out into the community for delivery. And if for some reason we ever did need to fully shut down the dining room, we would continue to be serving hot meals to your homes and have 2 choices of what you can choose. So we would be continuing to maintain as much of the standards that we're creating now as we go forward. That is not our goal, and this little pivot that we're making is a proactive one that will hopefully help us to be able to keep our dining room open, but it's all going to be dependent on the circumstances that affect us, be it this virus, be it the ability to staff, and everything. So we're proud of what we've got going on here, and I want you to know that we are committed to continuing to get our campus back to its normal running as it was before, within reason. I mean, there's going to be definitely changes after this virus on how we do things. And I guess one of those changes, that we're experiencing now is that there's no food and drink here for the CINC meeting. And in the past, that was a big draw for people to be able to come and to be able to get, some food and drink, have some camaraderie with one another, get to know people on a more personal basis. But, the social distancing that we're becoming so accustomed to now is going to be a part of us for, some time going forward. And hopefully we can lose these masks. And by the way, I did mean during the town hall meeting that I presented to take off my mask and just be able to give you a look at what I look behind the mask. Do I really look like the picture that's out there? It wasn't an old picture. It wasn't one from 20 years ago. But I know that when you see us out on campus, you're seeing us with masks, and we're really trying to lead by example and keep everybody safe. There's different thoughts on a lot of what's going on right now, and I just want you to know that everybody being safe and healthy is at the forefront of what we are doing here. So we do have a lot happening with the coronavirus, and we did make it through the first wave of the coronavirus without any positive cases. I don't even think we had an exposure from one of our contractors, during that period of time. But since we've had this resurgence, and we've all seen the news about how many cases are happening in Florida and even in the Jacksonville area, we have had more and more people who have come into contact with people that have tested positive. I think during the first wave, if you're like me, you didn't even know anybody that had coronavirus. And some of y'all were coming up to me and you were saying, I don't know anybody with a sniffle, let alone a flu. What is this coronavirus? And it was hard to comprehend. But now, during the second wave, we know that there's been people that have come into contact with others that have had the virus. And because of the personal responsibility that we are all displaying, the conservative approach that we've put into place in our health center with utilizing the N95s and the staff that are working in the health center and assisted living to change their clothes when they get to work and change their clothes again when they're done work, all of that has helped out that when people have come into contact with somebody that has had a positive test, that it hasn't resulted in other positive tests. That we've had very few of those circumstances. So we're proud of how that's going, and the fact that we've got so much going on and that we still do have our dining room going on is representative of how well we're doing, even though when it seems like there's a lot of exposure letters that are being distributed. But it's because we want you to be aware. We want you to be aware that we did have these exposures and what we are doing to make sure that we help control this virus and keep it from spreading on our campus. So as we move forward, in our presentation, and I always like to kind of do a partnered approach to a presentation, and as we move forward in this, maybe we'll be able to bounce back and forth on topics, but Maryland is our health services administrator, and she's responsible for both the health center and assisted living and the health resource nurse or clinic. And so she's responsible for all clinical aspects of our community. And we asked her to be here today to share with you a little bit about how this is impacting what's going on in those aspects of our community as well. Yes, ma'am?
I received an email today from someone in Jacksonville who said they saw in the paper that we had 3 deaths at Westminster Woods. Is that true? We have not been informed.
So the question is that she received an email from somebody in Jacksonville who said that we had 3 deaths at Westminster Woods, and she was wondering if that's true. And I did put out a letter this week responding to that article. So I guess if I step back a second, with the communication, we've started to utilize more electronic forms of communication. I was made aware that there was a list of people who have given their email addresses but have said, I don't want to be communicated by email, so that's kind of an opt-out list. And we're respecting that. But we're using email as a primary form of communication for the letters that I'm putting out in regards to the exposures or anything that's happening, the campus updates and all. And so if you want a hard copy, all you have to do is tell the receptionist that you would like to have a hard copy, and we will put you on that opt-out list, and we'll make sure that, we want to make sure that everybody is getting the communication.
The letters that I've received said we had exposure, but nothing that could mention about deaths on campus.
So on August the 2nd, the state put out a list, or the Department of Health put out a list of deaths in long-term care facilities. And the report said that we had 3 deaths associated to COVID here at Westminster Woods. And that information is incorrect. We did address it in a letter responding to that earlier this week, and we did say that there was a person that was already on hospice that had tested positive and passed away, but we really didn't experience any different symptoms or behaviors in his disease process than what he had before. We don't determine, cause of death, and if someone was to die somewhere else, we may not be informed of the cause of death. So we didn't have a reason to be communicating, deaths related to COVID, and we weren't aware that this report was coming out either. So when this did come out, then I did put out the response to it, and it said that we had that person, plus there was a person in the assisted living who had died elsewhere and had tested positive. And so those are the two that we're aware of. And in Maryland's communication with the Department of Health, they've assured her that they're going to be correcting that information going forward. So it should be saying 2 instead of 3.
Let me interrupt you. Am I turned on? No, turn me on. You turned me on, man. I didn't want to, I don't mean to interrupt, but we're going to have an opportunity to ask questions. But I'm going to wait until Marilyn finishes, and then you all will be able to ask questions of Marilyn or Brian. And then we have, excuse me, people in the other rooms that may have questions, and we'll be able to get those questions at the same after we finish in here. So I'm going to let you sit.
Okay.
Sit down. It's not often you can tell the boss that, is it? Marilyn Cameron was born in Minnesota.
Yes.
But she grew up in New Jersey.
Yes.
Okay. And finally found her way into the real world and came to Florida and has been with us. And I could tell you all the stuff she's been involved in, but I forgot it. But Marilyn is in charge of everything that Brian's not.
Good morning. Thank you for letting me talk. My name is Marilyn Cameron, and I have been in the senior industry for 27 years. 8 of those years being in Westminster Woods. I am a nursing home administrator, and I hold a license in New Jersey as well as Florida. My role here consists of being the administrator of the healthcare center, and when we talk about the healthcare center, we're referring to the rapid recovery, now we call it the admissions transfer unit, and the healthcare center, which is our long-term care unit on our 2nd floor. I'm also the administrator of the assisted living, which is a 60, currently we have 60 apartments. We're licensed for 80 in our assisted living, and Elaine Simpson runs the day-to-day operations. And then I oversee the therapy department, which many have been coming to our therapy, and we are very excited because Westminster Woods was one of the pilots to open up on outpatient therapy. So we have speech, occupational, and physical therapy currently going on in as far as in our therapy gym, which is great. And then many of you, maybe virtually or in person, met Cynthia Rinchie, who is our clinic or health resource nurse. And she runs the clinic, and I kind of help her and oversee those aspects. But it's been, I was right when Brian came at the start, and no, he did not start the virus here on campus, but I was out for medical reasons, and came back in May. And boy, what a change it was. But I can say how proud I am of working on this campus and working for Westminster. The staff are so committed to the care and excellence of everybody who lives on this campus in all levels of care. I couldn't be prouder. I kind of want to walk you through what is happening in all different levels of care so you have a better understanding. And when somebody is coming in, let's say from the hospital, they come into a rapid recovery unit, and I'll say, my parents have been in a rapid recovery unit, so I wouldn't ever let anybody who I love go to a place I didn't think was great. Okay, when they come into our rapid recovery unit and they come from the hospital, okay, when they come in, it's now considered an admission transfer unit, and everybody who works in that unit is contained in that unit. We all do come in our street clothes, and this is the first day on work that I've worn street clothes, so it's great. We all change into scrubs, but when they are working in that unit, they can only work in that unit. All the residents and the patients who are working through their therapy and their recovery in that unit, they keep in their rooms. No one is allowed out in the hallways. Therapy is in the rooms. Meal delivery is delivered to their rooms. If for any reason anybody should have to come out in the hallway, all the residents or patients have to wear masks. But those employees come, work in that unit, change their clothes, and have to go home. They can have no interaction with any other employees. Okay, so we're really, really trying our best when anybody has a potential exposure from the hospital environment to minimize that as much as possible. On our second floor, which is our health center, which is generally our long-term care, all the staff are in 95s, and the residents, again, they have to stay in their rooms, which is hard. It is a hard adjustment for the staff as well as the residents for their quality of life. And I can tell you that the activity staff is doing an incredible job. We have an abundance of iPads. They're doing Zoom with family members. They're just trying to keep the spirits up in our health center, okay, just trying to keep that interaction. And Amanda Birch, our previous executive director, she for Westminster Communities of Florida, she just got us a grant for 7 new iPads to be able to continuously communicate with family members, because it is one thing that they don't get that physical interaction with family. But if they can video conference, it gives us, everybody, just a little bit more joy. Our therapy department is still functional, and it's doing inpatient in the ATU. It's actually doing inpatient in the health center as well. But they're also doing outpatient in the gyms. None of the residents in the health center or the ATU can come into the gyms, as they have to remain in their rooms. But outpatient-wise, all of the outpatient who lives in the general community can come into the gym and receive their therapy as long as they're wearing the mask. In our assisted living, again, everybody in their assisted living, all our residents there must remain in their apartment. If they should come out in the hallway, they wear a mask. Our staff, our dedicated staff is there, all in N95s, just like the other areas on campus. The staff, I can't say, it's very hard working in N95. It's very hot, okay, but they're so very dedicated and working so very hard to provide the great quality of life. And our health resource. A lot has changed. I'm usually here at CINC saying the options of what we have available on campus and what we can provide in the clinic, which is right now, due to potential exposure risks, on hold. A lot of physician visits are on hold, or Cynthia can do telehealth visits and help people do telehealth visits. We usually have neurology, podiatry, a hearing aid specialist, dermatology. There's an abundance of professionals that we usually have coming on this campus to make it easier for our residents to access professional services on campus. Right now, we're only doing essential services. And essential meaning, life-sustaining type services, or what we are doing, which is a blessing, is for diabetics, the podiatrist will be on campus next week. So if you are a diabetic and need to see the podiatrist, please contact the Health Resource Center. It is with what's going on in the world right now, I just can't, again, say enough about the leadership that has been provided through Westminster. Usually on a Thursday night, 9 o'clock, we'll get new guidance that comes out, and that from the CDC or our governing agencies with new roles and new strategies that we have to follow. And I can't say enough about the staff and their ability to change, flex, and provide the professional care that everybody has here in providing those services for our more vulnerable patients and residents on campus. I am so very proud to work with them. And we do, as far as my intimate relationship with the Department of Health, it is, I speak with them quite often, and not only for potential exposures. The Department of Health has come on campus at least twice to do inspections of what we're doing here in our assisted living and in our healthcare center. The Department of Health is looking, they have an infection preventive specialist that comes on site. They were very complimentary of what we've put in place as far as infection control purposes on this campus. Also, our governing board, we take a lot of pride in our health center of being a 5-star facility because we feel, for the most part, is the care perfect? No, there's no perfection, but they do their darndest and do the best they can. But we are a 5-star rated facility from our governing board, which is CMS, and they come out usually yearly and inspect us. In the last 3 years, we've been deficiency free, which is hopefully ongoing. But we have been blessed in the last month to have them out twice to our health center to give us an infection control survey. And I can say proudly that we have gotten deficiency free on both of those inspections. So I can just tell you how hard our team is working in the health center, in assisted living, to do the best they can during this current crisis to make sure that the appropriate level of care and the appropriate measures are in place. So, all right. Thank you very much.
Thank you, Marilyn. Thank you, Marilyn. I'm going to take, just for those of you who are here in the auditorium, if you have questions, now's the time to be identified and come up here, and that way we'll get you on the camera so those other folks can see you, and you can address your question to either one of these two. Or you can address it to me, but I won't know the answer.
Okay. I would like to know what is being done to provide grief counseling for those that are enclosed within their rooms. Because I personally know that there's someone who lost their wife at the beginning of March, or the end of March. And I know him, and I know his personality. So I know at this time that he must be having an extremely hard time dealing with his grief. He's by himself, and he was once a very intelligent, active man who now has lost his soulmate. So I'd like to know what is being done to help him with this level of grief and loss. I would also like to know what is happening with the grief and loss of a lady that lived in Eastwood for over 20 years and was forced to move into skilled nursing. She didn't want to go, but now she's there. And I didn't know her, but I know I've heard from people who did. And I just wonder, what can you do? Is the chaplain addressing grief and loss? And if not, I would just encourage you to look at that and find ways of helping them through that. I think for us, we live independently, and I walk along campus, and I meet a lot of people. And one of the things that I've heard so much is the poor people, that could be us mentality. So there's a lot of fear and frustration on the campus as we see them not being able to get out and get fresh air, wondering what's going on in there because we can't go, and then knowing also about the grief and loss issues. So if you could address that,
Certainly.
I'd appreciate it.
Good, thank you. Marilyn?
I can let you know that Chaplain Leslie does a spectacular job in all levels of care. She is involved in any grief and loss. She is very active with residents and family members. Some are more accepting than others, but she is up in the health center many times throughout the week, as well as in the assisted living. And we're not just talking about the loss or death, but a role change as well. And she is, and we also have a social worker too, who's able to speak with people. So we do recognize that, and we also, because of it's a different role for our staff as well, and that's why we have our EAP program out there and giving that information to our staff too, because it's a role change for everybody. Just to let you know, every once in a while, our activity staff, we do take some of our health center residents out to the front patio for, at one at a time. So we are able to do that in small increments.
Yeah, I think as you can imagine, it's hard for us to do all that goes on here without everybody working together. And there's grief and loss happening in all levels of care of our campus, and even within families. And right now, while a lot of people are still disconnected from their families, they're learning of, deaths, within their families. And I had learned about a death of an extended family member of somebody in independent living. And when I reached out to Leslie to ask her to go and follow up, she told me that she already knew about it. Mm-hmm. That when one of the dining service people were delivering the food, they had found out, and they had already told her, and she had already followed up with them. And then I was able to follow up as well. But something that we've tried to publicize and may not be as widely known or understood is that we have an employee assistance program. It's called an EAP program. And it's a group that's able to provide assistance to our employees regardless of what their circumstances might be that they're going through. It might be something that they want to do to better themselves rather than just the hard times that come upon. But our EAP has extended services to all of our residents as well. So we put the number out there in a couple of places, and it was most recently, in the letter that was addressing the article. And we encourage you, if you have any questions or concerns, and you think that somebody might benefit from talking to a professional, they can call the EAP program in addition to the resources that we have here on campus.
That's tremendous. Thank you.
Okay, are there other questions? Yes, John?
Yeah, I'd like to know about accessing the professional help in the healthcare center, the cost about that. You bring your own insurance, or how does that work?
Great question. And through the Health Resource Center and for the professionals there, they do accept the insurance, and they will bill your Part B, okay, or your managed care. We do not handle their billing, okay, for those who come on in, but they will handle your billing because they'll ask for your insurance information, and they do their own billing through your Part B or your Medicare managed care plan.
Do you need references from your primary care physician?
It depends upon each individual's insurance. If it's for traditional Medicare, generally you can just go ahead and see the podiatrist or the audiologist or anybody. You don't need a referral. But I don't like to say that as a whole because everybody might have a different managed care that they would need a referral. Okay, but they usually take all general managed care companies as well.
And don't we ask people to update the health resource with their current?
We do. Every year, the Health Services Committee requests continuously to please provide us with your health, health insurance. And this year, especially because everybody's Medicare card changed. Actually, ended last year, it changed. So we wanted to make sure we had correct billing information so nobody got a bill. So that was essential. Every year the Health Resource Center, along with the Health Services Committee, request, please submit your new insurance information to the business office and the health or the Health Resource Center, and we'll share that information so we can bill correctly.
Other questions? Going once, going twice? Pam, how do we communicate with the folks in the other room that may have questions?
Invite the people to say, anybody in the River Lounge has questions? Charlie's moving up to the mic right now. Charlie, can you hear us?
Yes, I can. Let me get you going mic here.
The internet, I dropped that one.
Okay.
I will be able to hear them, but we won't see them. So please identify who's speaking for us, okay?
Yes, but I've got to get the unmuted muted here. Oh, can you hear me, Pam?
Yep, we can hear you. Can you hear me?
Good. Yes, I can. Thank you. Just a moment. Let me ask if anyone does have a question. It appears that there's no one with questions in the River Lounge.
Okay.
Are there questions in the gathering place?
There's no people in the gathering.
Well, I guess there are no questions down here then.
Is there any remote users that
Any other questions here?
remote? Anybody at home?
Oh, anybody at home watching on television? How are the Braves doing? Oh no. Any other questions from home?
I'm not seeing any going once.
Nothing's coming up. Okay, listen. This brings us to a conclusion. I want to thank all of you for being here, especially new members, and don't quit asking questions. Any of us who have been here even a short amount of time or long-timers will be glad to do our best to answer your question or steer you in the direction to those who might have a better answer. I will say that our next scheduled meeting is September the 12th. It's the second Saturday of September. And so far as I know right now, we will continue to follow this model until somebody tells us that we can do it differently. We need your input. If you have suggestions, you can speak to me or to Tom or Pam, or Rachel is in the back, Rachel Cohen, anybody on the committee, to give us your feedback as to how this kind of experience went for you and was it helpful, because we want to make it better if we possibly can. Again, thanks to Brian, and thanks to Marilyn, and thanks to you for being here, and we stand adjourned.